Celebrating service in Nye County for 10 years, Desert View Hospital.
We know what causes artery blockage disease. We call that coronary disease. That's what leads to a heart attack where the artery's clogged, closes off, causes damage to the heart muscle. How do you detect that early? Well, stress tests are very valuable, but they don't actually look at plaque. You have to have really advanced disease, 70 to 90% artery blockage before that's going to show up on a stress test. So we treat people to prevent disease based on our perception, based on calculation of their risk. And they're treated with anti-cholesterol drugs based on that. Wouldn't it be great if we had a test that you could do that was simple, no risk, very low radiation, that would tell you with certainty whether you've got early buildup or not? Because wouldn't you want to know, gee, do I have this, and therefore what can I do to keep it from getting worse?
Yes, I would love to know that.
And what if your doctor instead says, gee, you have a high cholesterol, family history, you need to take 3 different medicines to get your cholesterol down, but your question is, gee, but what if I don't have the disease? Then why do I need to take these medicines? Yeah. Wouldn't you want a test that would tell you that?
Yeah, and I hear that we have a new machine here.
We do.
Tell me about it.
So coronary calcium scoring is a technique that's been out for 20 years. And the score is called the Agatston score, named after Dr. Agatston. And the amount of calcium plaque in that artery correlates with your likelihood to have a heart attack over time. That test is really the equivalent of what I would call a mammogram of the heart, because you're getting preventive information. Very low X-ray exposure. It's one of the least exposures of any test. It's equivalent to roughly 10 chest X-rays, whereas, for example, a CT scan is equivalent to about 200 chest X-rays. That's the difference. So no risk to the test. You see how much plaque there is in the artery. You can quantitate it, and then you can make a determination as to whether your patient even has early disease or how advanced the disease is.
How can a person get one of these tests?
It's actually very simple. You don't even need to see a doctor to get this test. This is one of the few things a patient can have without a doctor's order. The best way to do this is to call our office, 775-751-7100, and say, hey, I'd like to get a coronary calcium test done. I can just give the order. They go to Desert View Hospital. It takes 3 minutes to do this test. There's no IV needed, nothing, and it's a $49 cash pay test. Most insurances actually do not cover this because traditionally in the United States, insurance does not cover tests that are involved with preventing disease. Mammography is one exception to that. Colonoscopy is an exception, but the vast majority of tests in the United States are not covered when they are ordered for preventive purposes. That's why the test is priced very low.